Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. I'm going to continue on now with my video series on your cancer survivorship team. Now, I have already previously recorded a video on dental care, but I want to include dental under the series for your survivorship care. So let's talk about dental. Doesn't really seem related to cancer care, but it is. And mainly if you are dealing with any kind of cancer around the head and the neck area, or if you've received any kind of treatments such as radiation to the area of the head, neck, and shoulder area. These are basically the areas that will, if you're treated with radiation, will put your jaw and your teeth at risk as far as an accelerated disintegration, degeneration, things like that. Whether it's your bone, whether it's enamel loss off your teeth, which of course is going to result in more cavities and likely loss of teeth. So a couple things that happen with these dental issues, with the loss of the bone, the loss of the enamel, things like that. Something called osteonecrosis. Now, osteo, of course, meaning bone, necrosis, and I've got to word this so that I don't get flagged by TikTok. Necrosis is the same as not alive. So bone, not alive. Okay? You have that, and like I said, the loss of the enamel. What this means is if you go in for certain dental work, you may be advised against it. In fact, if you're dealing with a dentist that understands that your history involving cancer treatments and having involved radiation, they should have a huge red flag. Hey, we may not be able to do this. I am referring to things like having implants done. When they drive that post into your jawbone, okay, if that bone is not alive, you're going to break that jaw. And therefore, it's been advised, at least to me, that I don't get implants, and other patients may face that same thing as long as the dentist is informed. I have lost since 2008, when I became aware of my late side effect issues. I've lost 4 teeth. They've just simply broken. Again, losing the enamel, they get weaker and they just crumble. In fact, the oral surgeon that removed one of my teeth was like, "You were right," because he wanted me to try to save the tooth. And I said, "There's nothing you can do about it." And as he went to pull the tooth, it just crumbled. And again, this is from the extremely high dose radiation that I got. And you have to understand too, there's 2 different levels of radiation to consider. Those of us that were treated, more than 15, 20 years ago, which I was treated 38 years ago, we got treated with such a high dose radiation that it really has caused a lot of damage for our teeth and our jaws. So, whereas depending on the type of cancer you're dealing with today, for instance, I have an uncle who was dealing with tongue cancer, and of course, he's having a lot of dental problems. And that's only 3-4 years ago, where he is now looking to need all of his teeth being pulled. So it all depends on the patient and the situation, the treatment that was involved. Another thing that has to be considered with dental work with many cancer patients, and it depends on your immunity susceptibility, your white cells and things like that, or if you're like me again, treated 38 years ago, when they used to remove spleens to help in the staging process, I have to take prophylactic antibiotics. What does that mean? That means my dentist will prescribe an antibiotic, usually amoxicillin, a crazy dose, like 2,000 milligrams, that I have to take 1 hour before my dental work. What does that do? Well, when the hygienist is in there and she's scraping and flossing and stuff, in the event that any bacteria gets into my bloodstream while she's doing that work, the antibiotics are supposed to prevent that from, getting to my heart and causing lots of bad things to happen, such as sepsis. And that's a separate video to talk about. But anyway, many dentists will prescribe that if they are aware of a cancer history or treatment history. Um, let's see. And I think also if you are a patient who has to deal with heart issues, like I also have to deal with. So, because my heart is so badly compromised from the various heart surgeries and the treatment side effects, I do have to take those antibiotics anytime that I have dental work done. So, the other thing that a dentist should require you to do, whether you are just getting done with treatment or whether you're a long term survivor like me, they should be requiring a clearance for you to be seen. And that lets you know that your dentist knows that they are dealing with somebody who needs the extra care with their dental work. So that's it. Like I said, I have a previous video that I did on dental work. For instance, treating, with tooth extractions and other issues like that. So I'm going to continue on with my series of building your cancer survivor team with more videos to come, specialists including cardiologist, pulmonologist, gastroenterologist, endocrinologist, all the ists that I currently deal with. And if I come up with any more that may be a benefit, I will also include those. Until next time, this is Paul's Heart.